Dr. Marty Makary joins me now from Austin, Texas. He's a professor of public health at Johns Hopkins University. Welcome, doctor. Thank you for being with us. So this coronavirus has a pretty low fatality rate, just 2%. And that is a much lower rate than the avian flu virus, which has a significantly high fatality rate of 60%. So can you explain why health officials are more concerned about this outbreak?
Yes, but the fatality rate could be much worse. And when you do see higher fatality rates out there, for example, Iran is reporting a fatality rate of 14%. It's probably just a function of how many people they're testing. Many of the minor cases are never getting tested. A case fatality rate of 1 to 2% is relatively favorable in the spectrum of what we could be dealing with. Look, we don't want to create hysteria, but at the same time, we do have a track record of under preparing for these problems in the past. I think we're going to be fine. We're probably going to power through this flu season. We're almost through the midpoint anyway. We've done a pretty good job containing. There's been excellent airport screening early, even with the late notification from China. So I think we just want to educate people on what they should be doing as a prepared response.
And who is most at risk, doctor, and what should we all be doing to protect ourselves?
Well, we know that if you tend to get the flu, you're probably at risk. Some people tend to get the flu. Some people have lower white blood cell counts, lower immune systems, work in areas that are congested, take public transportation. They may have a habit of not taking the right precautions. We know that older Americans that have weakened immune systems and those with comorbid conditions like diabetes or any particular special condition are at highest risk, and the fatality rate is higher in those individuals. People should take the right basic precautions.
Does it appear that there may be a subset of the population that is just genetically predisposed to having a more severe reaction to the coronavirus?
Well, that's definitely true. People are just predisposed with different immune systems. But most of it, I would argue, is behavioral. If we recognize that older populations and those with diabetes are particularly at risk, let's remember some people do a good job not touching their face and eyes. Some people do a good job with general sanitary conditions, with sneezing into their sleeve or turning to the side or washing their hands frequently. Those are the behavioral factors that people really need to drill down on right now. And you know what? Just for the next 2 months, don't hug anyone. Don't shake anyone's hands. Wash your hands frequently. These are basic steps we can all do.
Good advice. And Dr. Makary, is there any update on a vaccine? We know that there have been, a lot of people thinking that once a vaccine comes out, the markets will stabilize, people will calm down. So what's the news on that?
If you look at our history of developing vaccines for things like SARS or Ebola, we tend to have too little, too late. And even when the vaccines are good, they come after the flu season or the viral season. So I think we're going to have a vaccine. It's not that complicated to develop one. It's just a long process for testing and trials and immune response and for mass production. Our experts are generally suggesting it might be a year, maybe sooner. You're looking at the stock market, get all excited when one company announces something. The reality is we're probably going to power through this without a vaccine.
Well, all right. Now, you ran down all the things that we should do, wash our hands frequently, maybe not hug too many people right now, practice good hygiene. But what about those face masks? We've heard that they might actually be more harmful than helpful. What's your take on them?
Yeah, well, first of all, Tanya, I would say just if you're a hugger, just take a 2-month vacation, okay? No hugs for the next 2 months. The most important thing, and people don't realize this, it's not as much a air transmission as people think. Yes, it is in droplets, but it's not a spread through the air as it is from touching our eyes with some sort of moist droplets. That's what we really need to avoid, and that's what those masks do nothing for. Look, if you're wearing an N95 mask or even a small basic preventive mask, they're going to do nothing if you touch your eyes. And so if you have the flu, do what many of the Asian cultures have accepted a long time ago: wear a mask in public places and take extra precautions. But don't think these N95 masks will stop the transmission, because all it does is work on the droplets that come out of the mouth.
Right. All right. So you're not fully covered. All right. Dr. Marty Makary, thank you so much for your insight into this frightening condition. You have actually alleviated some of my concerns. So thank you.